Just hold the phone here. That's what my old referee Pop Haggerty used to say. Hold the phone, hold the phone. Are we ready, Mike? Yep. Good afternoon. It's really a beautiful day in the state of Washington. We have some good news, actually on a number of fronts. First off, we have good news that we are opening our schools for in-person instruction, and this is such good news for our students. We know that in-person instruction is the best way to do instruction. It's best for the teachers, it's best for the students, it's best for the parents, and we know that this can be done safely. And the great news today I can share with people is that we are increasing the number of days that our students can have in-person instruction. We already have over 200,000 students who are today receiving at least some significant in-person instruction. And that is increasing every single day. And the reason it is increasing every single day is that we are learning that we can do this with safety, and we are learning we can do this safely all over the state of Washington. We have over 175 schools that are already doing this. They are doing this safely, they are doing this efficiently, and they are doing this with a resounding confidence that this is the best way to educate our children, while at the same time giving parents an option to remain in a remote setting should they desire to remain in that kind of situation. This is tremendous news for our state. We know that educating kids is tough in general, and our educators have been doing a superhuman job remotely, trying to get the attention of second graders, trying to keep third graders on task. And they've been as creative as possible. But all over the state of Washington, we are now returning to the way we know best, which is in-person instruction. Now, why have we been able to do this? We have been led by excellent educators. Our educators have been sort of like Lewis and Clark. They have been the explorers, the ones that went back to classes in person, have shown us how to do this. They've shown us that when our kids and staff wear masks, where they socially distance, where they have decent attention to ventilation, that this can be done safely. And we ought to be thankful for the educators, not just teachers, but engineers, bus drivers, nutritional experts, counselors, parents who have demonstrated the protocols necessary to make this safe. And we are thankful to them to show the way. And we are very happy that their colleagues now are looking at the experience that they have had, learning from their experience, and adopting those best practices in many places across the state of Washington. Now, we are not alone in this experience in the United States. It actually is becoming quite common. Last week, the Centers for Disease Control released updated school reopening guidance. And that guidance broadly aligns with what we are suggesting in the state of Washington. They basically have said unequivocally that if we have strong health and safety measures, returning to school is a safe thing to be able to be done if we pay attention to some of these safety protocols. And I think that the CDC, in effect, has confirmed what our educators have discovered, which is that this can be done safely. The CDC also made very clear that mass vaccination of our teachers is not a prerequisite to going back to school. And I look forward to when we have our essential workers, including teachers, grocery clerks, bus drivers, police and fire, child care workers, all can get their vaccination. But what we have demonstrated and what the CDC has confirmed is that we can have on-site education in a safe and effective way. And this is really great news for all of us. We need to continue this movement in this effort because we still have thousands of students who have had a difficult time in remote learning despite the tremendous work of their educators. And we've been working with our local departments of health and our state Department of Health to share tools to be made available to schools so that they can have increasing confidence to return to school settings. So today, to that end, today we are expanding the COVID testing assistance that we could provide to schools and school districts. This is part of our ongoing effort to give more students the option to return to in-person instruction. And it obviously increases access to testing, both for educators and students. The Department of Health has developed this testing pilot program during the last year, has been in place for 13 school districts, and it has become part of our playbook for returning our students to classes. So about 50 more school districts will now be participating in this volunteer program starting this month, and we hope these numbers will grow. It is not necessary to get back to school, but it's a way to help build confidence where educators, parents would like to have those confidence measures in place. So we're very happy about this. Finances should not be a problem here because, in part because of federal funding and in part because of state, our schools will shortly be receiving hundreds of millions of dollars that will be available for testing protocols and a variety of other needs of our school system. So this is yet another layer of confidence that we want to offer people to go back to Insight classes. Now, as part of this playbook, each district will also have the support of the Health Commons Project. This is a Washington State nonprofit that is committed to accelerating equitable education of our students. And they do an excellent job of working with local agencies to help with care services and delivering testing services where they're needed most. They do this by recruiting labor, making sure capital is available, although that should not be a problem, and accessing the best science and technology to fit the needs and the desires of the district to available testing. And they're going to lend their expertise to schools to provide a testing planner to school districts that participate in this program, to directly design a program for the schools that want them. Now, testing strategies are just part of our playbook. We're also helping school districts adapt to the rules that COVID controls that we have put in place as well. Based on federal guidance, as well as what we've learned through our local school district action, the state has developed what we're calling the Learn to Return Playbook. It's a public resource on how schools can get this job done. This playbook also includes health and safety requirements, of course, including universal masking, social distancing, and ventilation. And altogether, these things, I believe, will build confidence, as they already have, in our communities about in-person learning. And we know this, returning to school is not just important for our students' academic development. Schools provide nutrition and many other services that kids can't get at home. People from poorer and more rural communities struggle with remote access, and we know that despite our best efforts, that has remained the fact, whether it's because of lack of broadband or lack of support at home. Now, if these students can safely return to class, and the science says unequivocally that they can, we should, I believe, feel a sense of urgency to answer this paramount duty to our students. I know we all feel that. I know we have all the same desire. I know we've all had concerns about this pandemic. But now we have been armed with something very powerful, and that is knowledge and experience that we did not have a year ago. We have the knowledge of how to do this safely, and that knowledge has been given to us by our educators, our professionals, who have developed ways to do this safely in person, and we thank them for that guidance. I've seen this successful return to in-school programs throughout the state of Washington. As I said, there's over 175 school districts now doing this safely. I was at Elk Ridge Elementary School in Buckley 2 weeks ago. I wanted to tour Wenatchee High School last week, but we got caught in a snowstorm. But I did meet virtually with Wenatchee educators and staff and students and custodial staff last Friday. The photos you're seeing are from school districts that have returned to schools safely. That includes schools in Meridian, Moses Lake, Natchez Valley, Port Angeles, and White River. So we have demonstrated that this can be done throughout the state of Washington. It is being done throughout the state of Washington safely. Just share a couple observations that I've heard, and I think my role here is just to provide information for people that they can use when they make their own decisions. A teacher I met at Elk Ridge Elementary, he actually, I believe, is a high school teacher. He told me that when his district was considering going back to in-person learning, he really didn't think that was a good idea. He just didn't think the problems could be surmounted. But then he went over and visited a high school in Yakima, and he saw how the mitigation measures were being implemented. And that gave him confidence, because basically what he said was, what I saw was, is if you go to a hybrid model, where you have only about half of your students in the classroom at a given time, you can spread out. You can do some cohorting. You can keep people separated. And students actually are remarkably adept at wearing masks. They've actually been very successful in this regard. So he returned to his school, and now he's been involved in the White River district very successfully with a high degree of confidence. So when I've talked to educators, I've heard, a recognition of why it's easier to do education in person. But I haven't heard anyone demonstrate how it is impossible to do that. And I'm just very heartened by that. And again, I want to thank educators for their leadership in this regard. We know that there's nothing with zero risk in this world. But we know that we now have the necessary tools to mitigate that risk. And I've been very impressed with the discipline that educators have shown and students. And we know that where people have had communication between educators and the staff, the people who have been solution-oriented have found a way forward. And it's taken a lot of listening to one another. And we're just very encouraged that that's going on across the state of Washington right now so that we can improve education of our students. So today I've asked some experts in the field. I'm joined by Enumclaw School District Superintendent Shaun Carey and Health Commons Project Manager Sarah Sutton. So Shaun, could you give us some of your insights?
Good afternoon, Governor Inslee. It's my pleasure to be here today. And yes, I am the very proud superintendent of the Enumclaw School District, and just excited to be here. I will let you know that, and you probably already know this, we are a school district that's located in Southeast King County, and we serve approximately 4,000 students across 9 schools. We are extremely excited that roughly 80% of our students are back in our schools, and successfully. They've been successful here for the last over 1 month. It's wonderful to see our kids in person. And even though we can't see their smiles through their masks, we can see the smiles in their eyes as they head into the building. And that's just a fantastic feeling for us. In Enumclaw School District, it truly has been a team effort to moving to in-person learning. Our families, our teachers, our administrators all worked as partners in making this a reality for our students. I'd like to say a thank you to the Washington Department of Health and our partners from Health Commons, specifically Sarah, Ryan, and a few others for helping us design and implement the testing protocols and operations that fit our individual district's needs. Several of my colleagues have asked about our timeline for implementing this testing, and it was pretty simple. We started off with a single space testing pilot right before winter break. We came back from winter break and we had testing in each of our schools. Our K-2 students returned back to school on January 11th. Our 3rd through 5th students returned back on January 25th, I'm sorry. And then our 6th through 12 students returned back on February 1st. Our staff has appreciated the opportunity to participate in weekly testing. This testing has built some additional confidence in the adapted operational practices and protocols that we already have in place. The addition of COVID testing, working in tandem with our countermeasures and with our safety protocols, provides an additional layer of protection, if you will, for our learning community, and it allows for us to safely serve our students in this hybrid learning model. On-site COVID testing has also allowed us to respond quickly in the event of a positive case, to identify through contact tracing, and then to contain transmission of the virus. I can't say enough how much we are so grateful for our K-12 students to be back in our schools and in-person learning in our hybrid learning model. It's extremely encouraging to hear that other districts will have the ability to add this valuable tool to their return to learn plan. We here in Enumclaw School District wish each of our peer school districts the very best as they move forward. And if there's anything that we can do to help, we are here for them.
Shaun, thank you. Can I ask you a couple of questions? How do you do contact tracing in your district? Who does that? How do you do it?
So we've taken literally a page out of the Department of Health's protocol for actually doing our contact tracing. And we've worked specifically with King County Health Department to utilize the forms and utilize the processes that they've put in place. And that helps us to do our contact tracing. And
you mentioned masks. What's your experience with your students as far as mask compliance?
There is 100% compliance. Our students they're excited to be in school, number one, and they know what we have to do as a community, as a collective, in order to make that happen. And wearing a mask is an essential function. It's an essential piece. It's a part of the equipment that they need every day to be successful in schools.
Well, I want to congratulate you, and I want to tell you I visited White River, and the White River High School mascot, of course, is the Hornets, and Enumclaw High School, their mascot is, of course, the Hornets, and those two high schools, you are rivals with each other, and I want to assure you that I am rooting for the Hornets in that rivalry game. So I'll be with you in spirit. And
all right, go Hornets.
Please thank your educators who've made this possible. We really appreciate their leadership and what they're doing. Oh, by the way, I want to ask you, so do you provide a remote option for your students?
Absolutely. We've got roughly 20% of our students who are participating in a remote learning environment.
And that's a decision by the parents, I would assume.
Absolutely.
And how has that worked as far as distribution of the staff? How have you been able to make that work?
Well, it does take some innovation on our parts, and I can tell you that since the beginning of the pandemic, it's been all about innovation. We do have students at the elementary level that are served specifically by staff that are designated for remote learning. And then at the secondary level, we have students who are actually, they're remoting in to the classroom. So they're actually participating on a Zoom basis.
Well, thank you. I think this is an important aspect of this, to give people options. And to my knowledge, every district that has returned back to on-site instruction has provided that remote option, because there's quite a number of parents that would still prefer that option. So I'm glad that you and your colleagues have been able to work out that alternative. I think that's really, really helpful. Thanks, Shaun. If you can stay with us, there's folks may want to ask you at the conclusion of this. Now we have Sarah Sutton from the Health Commons. Sarah.
Hi, thank you, Governor Inslee, for having me today. It's my privilege to introduce you to Health Commons Project. and to explain our role in the Learn to Return testing program. Since the beginning of the pandemic, Health Commons has been supporting Washington communities in designing and implementing robust COVID-19 testing programs. The Learn to Return testing program is a continuation of our work to ensure that Washington communities have equitable access to low-barrier, evidence-based COVID-19 testing services. Schools that voluntarily enroll in the Learn to Return testing program will be assigned their own Health Commons testing strategist. The testing strategist will help districts design a testing program that is tailored to their school community. It's important to know that there is no one correct way to do COVID testing in schools. The testing strategist will ensure that each district understands the testing technologies available to them, develops testing literacy, and implements a sustainable testing program that can last as long as there is COVID in our communities. Now, I've heard from the Washington schools that I've worked with that at first testing can seem overwhelming, but it is doable. There is a growing network of over 60 school districts who are partnering with our team to offer school-based testing. These districts represent 20 counties. Some are large, others are small, urban, rural. Some are open for K-12, and others are working hard to bring back their early learners. Our team has been so inspired working with these districts and seeing their desire and drive to serve their communities. On behalf of the entire Health Commons team, I'd like to thank Governor Inslee and the Department of Health for this opportunity to support our schools in reopening and staying open safely. Thank you.
Thank you, Sarah. We really appreciate you providing this service. I think it can really, really help. And one of the things you said that I think is important, that different schools might have different viewpoints on this. Some may use this for doing staff. Some may use it a combination of staff and students. And some may use it effectively for folks just who've been contact traced. So just giving people a boutique possibility on that, I think, is really great. So thanks for stepping up to the plate. And if you can stay with us for a few minutes, I'd appreciate it. Now, we've got some other good news on the vaccine front. This morning on a call with the White House, we were advised that national doses will increase this week from 11 million doses nationally to 13.5 million doses this week. So we generally get maybe 2% of those additional doses. That is not a for sure, but that is a significant increase for Washington State. And we're very appreciative of the Biden administration's very quick action to increase these supplies, because we know the supplies are the limiting factor. If we get more doses, more Washingtonians get vaccinated. We are ready to go to make sure that happens. In addition, the administration has opened up a pharmacy channel of direct distribution from the federal government to pharmacies directly. That will increase from 1 million to 2 million doses a week through the pharmacy channel. We don't know the exact numbers of what that will mean for Washington, but it is not an insignificant bump that we now have been experiencing every week or two. This is really, really great news. And as you know, the administration has also purchased additional hundreds of millions that should be available later in the year. And of course, we're waiting with bated breath for the J&J potential clearance in the next few weeks as a possibility. We now have over 1 million vaccinations in Washington State. More than 245,000 Washingtonians have already been fully vaccinated. Each one of those is a blessing. And here's some good news too, because we have had a very rapid increase in acceleration in our rate of vaccinating Washingtonians. More than 81% of our supply is now in people's arms. We now rank 12th out of all the states. I want to repeat that. Washington State ranks 12th as far as the percentage of vaccines we have been given that actually are in people's arms. We're very proud of that achievement. Frankly, we started at a lower level. It's estimated, however, that there's another 700,000 Washingtonians who are eligible right now, and that's why we need more product. So the production and distribution of this will increase. Medical providers are improving their methods for scheduling people for both doses. And at the state level, we are moving forward with significant investments in outreach to communities to make sure that we have equitable distribution, including pop-up and mobile vaccine clinics. I talked about that a bit yesterday. About $15 million will be allocated to that effort. And as you know, we now are working with the All In Washington Philanthropic Group. That group has already raised $100 million during the crisis to serve communities in need, and we are hopeful of increasing their support in a partnership with the state of Washington. These are complementary to our goals. Update on some other big action in the legislature. I am really hopeful that the progress we're making towards a transportation package in the state are successful. This will support accomplishing multiple needs in the state of Washington. We need a package that prioritizes preserving the infrastructure we have, which has been in a declining state to some degree. We need to improve safety to reduce fatalities and injuries. We need to fund our legal obligations that we have that are significant. We need to reduce the pollution that causes climate change. We need to give people more options in their transportation opportunities. We are a growing state, and we have to look forward, and that includes a transportation package. Just a comment on what that entails, these things are not cheap. We need to invest more than $3 billion to remove fish passage barriers. This is not an option for legislators or the state. It is a binding requirement by court order, and we have to fulfill that, not just because of the court order, but because this is necessary if we're going to have salmon for our kids and grandkids to fish for and for orca to preserve their existence. We need more than $1 billion to replace the I-5 bridge over the Columbia River. That was built during the Woodrow Wilson administration, and we are very concerned about its structure. We need more funding to catch up for the backlog of our preservation projects as our payment deteriorates. And in order to continue our ferry service that we have today, we are going to have to replace 13 of our ferries over the next 20 years. And we hope that those will be electric, which is cheaper. You don't have to pay so much for fuel. So we have an opportunity this year to move forward on transportation. I have proposed one way to finance that in a cap and invest system that would simultaneously fund transportation projects and reduce carbon pollution. And I look forward to the legislators moving forward. One of my priority bills, the Clean Fuel Standard Bill, has now passed the House Energy Committee and the House Appropriations Committee. Very happy about that progress. I'm optimistic that HB 1091 will pull a hat trick with the House Transportation Committee and will ultimately clear both chambers and reach my desk. This is the right thing to do. It is the necessary thing to do. We do not have options. The climate change disaster that is unfolding does not permit further failure to pass this bill. A clean fuel standard will help reduce climate pollution from transportation. And that is our biggest source of climate change pollution. Now, when we reduce air pollution, and this is really important, this is not just an environmental bill. This is a health bill because it will reduce the pollution that is causing asthma in our children, that is causing respiratory problems in our older folks, that is causing cardiac problems. This is a health bill, and the health of Washingtonians depends on reducing the pollution that literally is killing them at times. We know that this is worse for people who live close to highways, where they breathe diesel smoke in their sleep and develop chronic problems. We need to reduce that toxicity. Washingtonians deserve this, and we're going to make sure that they get it this session. This is a very tried and true proposal. Right now, all up and down the West Coast, this is in place. In British Columbia and Oregon and California, the only place that we do not have this is the state of Washington. Our people deserve this healthy condition. So I'm looking forward to cleaner air, more energy choices for consumers, the freedom from oil monoliths that so far have shackled us to the pump, and ultimately less expensive transportation fuels. So I'm very excited about the progress that bill is making, and I'm looking forward to your questions. And by the way, feel free to ask our guests questions as well.
Governor, Superintendent Carey and Sarah have had to hop off.
Oh, no. Oh, no.
Unfortunately, but Lacy is available.
Okay, we have Lacy from Department of Health is available. Apparently they hopped off. They're educating students, which is good.
Right. With that, we can go to our first question, which will be Rachel LaCourte from AP. Go ahead, Rachel.
Governor, it sounds like some of the hubs that supply vaccine to states have been impacted by the winter storms. Have you or Department of Health been notified how that will affect supply here in Washington in the short term? Also, as it relates to the error that initially held South Central region back from phase 2, if the mistake of one facility can have such an impact on an entire region, doesn't that indicate a flaw with the current plan, and do you intend to make any changes?
Lacy, do you want to address whether we have any delays because of the weather?
Sure, yes. Thanks for the question, Rachel. We do have some shipping delays coming from the national distributors to our sites, and we did try to send out messaging to our providers and the public about that on Friday. So typically vaccine arrives to most providers on Monday. Due to winter weather across the country, not only here in Washington State, there were some delays. And so some of those vaccine clinics that were scheduled for today and tomorrow in particular probably got rescheduled. We are also aware there were some clinics here in Washington or mass vaccination sites that closed due to weather here in Washington State. And in those cases, the providers have tried to reschedule people for appointments this week.
We are very happy that all of Washington State moved to phase 2 on the same day, and we succeeded in that forward step. We're very pleased by that. I think actually the system worked because the whole state moved forward on the same day, which was Valentine's Day. There was a brief interlude where one hospital out of, I don't know how many hospitals exactly we have, quite a few, that made an error, and that was fixed. The system worked. It worked because people went back and looked at their data, and I'm pleased that it worked. So no, I don't believe that's some systemic flaw. It's working, and people's lives are being saved. I want to reiterate this because I really don't think this story is told enough. What we're doing in Washington has had huge success. If you compare us to another state, the state of Arizona, they have a similar population. They have had 10,000 more deaths than we have. 10,000 people died, in part because they have not followed what we've done in the state of Washington. Our economy is doing relatively well compared to other states. We're moving back through these phases. We're getting a vaccine rolled out. We're 12th in the nation. I want to repeat that. We are 12th in the nation in the percentage of vaccine that has been administered, a story that has yet to be told. These things are working, and I think we ought to be pleased about them. We're returning to in-school instruction across the state of Washington. There's a lot of good news in this state.
All right, up next, we'll go to Joe O'Sullivan with the Seattle Times. Go ahead, Joe.
Governor, two-part question. Is Washington going to adjust to the way it assesses risk for schools based on the CDC's high-risk metric of 200 cases for 14 days, which is much higher than Washington's current standard? And I also wanted to ask you about the new proposed striking amendment, the capital gains tax in Senate Ways and Means today. It lowers the tax rate from to 7%, which is lower than what you wanted, and it splits that money into the education legacy account and into a new taxpayer relief account. Is that a proposal that you would support?
So as far as your first question, no, we don't have current thinking to change our metrics. They're actually very consistent with the CDC. We think you can comply very easily. We're basically on the same page as the CDC, which is this: the fundamental message for the CDC, the fundamental message of their metrics, the fundamental message of our metrics is that you can go back to on-site learning with reasonable protocols of safety. That's the fundamental conclusion, and so we're very similar to the CDC. So it does not necessitate any changes in our metrics. And I'm pleased by that, frankly, because, you know, is our experience somehow an aberration that we can do this safely? We have 200,000 students doing this safely. I mean, do we think we just got lucky? No. This is the experience across the United States, where multiple scientific journals have confirmed that this is a relatively low-risk environment, and these risks can be mitigated by the safety protocols that we have embraced. There was one study out of Wisconsin that concluded there's actually less transmission that the kids have while they're in school than they have when they're not in school. It's actually safer for them to be in school than out of school. And there's multiple scientific studies that have confirmed this. So having the CDC guidance, which confirms our belief, was comforting, but we've already shown the way again because our educators have shown how to do this safely. I haven't seen what you're referring to in the capital gains, so I really can't comment on the amendment you're proposing. Or are they your report? Excuse me.
Okay, up next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
I'm wondering, do you feel like comfortable with all K-12 students going back to school right now? Is that where we are based on what you're seeing in the science, or is it a slower moving idea?
Well, I think what we're finding is that many of the school districts have started with the younger students, and they have built confidence after they have brought some of their younger students back. And that has allowed them to develop the protocols, have educators be comfortable with them, iron out some of the details, and then move up through the higher grades. That has been a journey that has been successful in many, many places. I have seen multiple places where high schools have been safely conducted. Enumclaw is having a good experience. We were in White River the other day. I've spoken to Moses Lake folks all over the state. They're doing high schools safely. So I do believe that can be done. I will tell you maybe the acid test. And if I can, let me just share how I think about this. Obviously, I look at the scientific literature on a daily basis. Obviously, we listen to CDC. I listen to the stories across the state of Washington. But the way I kind of look at, like, how would I respond for a loved one? So I have 3 grandchildren in public school right now. I am thrilled that they have gone back to an in-school environment in the last couple of weeks. I would have absolutely no qualms of them going to a high school right now. I would feel it was much preferable to have them in person in a biology class rather than remotely. I also am a family of educators. My father was a biology teacher and beloved coach. My brother is a retired art teacher. My brother-in-law is a retired art teacher. My sister-in-law is a retired teacher. And I asked myself, could I ask them to go back into a classroom? And the answer is unequivocally yes, because it's reasonably safe to do so. And so I look at this from a personal lens through real people. This is not just kind of an academic exercise, the way I think of this. So the answer to your question, yes, I do believe high schools can be safe, but schools are going to find their own journey on how to get that position.
All right, up next, we'll go to Laurel Dumkovich with the Spokesman Review. Go ahead, Laurel.
Hi, Governor. I have 2 kind of related questions. I'm wondering if you can outline a little bit more your priorities for the next set of people to get vaccinated and where teachers will fall into that. For example, are we prioritizing farm workers next and then teachers? And then secondly, along with that, teachers already have a program set up with OSPI and Kaiser to kind of get them vaccinated. Are you thinking of doing something similar for other essential workers in that next group?
Yes, now teachers are being vaccinated today. So those over the age of 65 and those who are over the age of 50 who live in multi-generational hospital, they're being vaccinated today. So we're working our way through the teachers, if you will. The next tranche of Washingtonians after the long-term care facilities, after the healthcare workers, after those age 65, will be those in essential duties. That includes educators, that includes food processing workers, that includes grocery store clerks, that includes bus drivers, that includes childcare workers. And so this group of people who are in these essential jobs will be the next tranche, starting with those who are over the age of 50, starting with those. We've also done a provision to make it efficient so that if a vaccination clinic goes out to a food processing plant, they would be eligible to vaccinate everyone at the food processing plant, even if they're not over 50. It just makes it much more efficient. The same is true for a school. And I know Kaiser has offered to have about 20 sites that would be open to educators, not exclusively, but would be open to educators as well. So that would be the next tranche. And again, I'm very pleased that we're getting increased access to more vaccines so we can move through this current phase as quickly as humanly possible.
All right. Up next, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
This is regarding the expansion of the testing in schools. I haven't yet seen a list of the districts that will be added to in the expansion. You said about 50, but so without having that sort of specific context, I'm wondering how those districts were chosen to participate. If there was some sort of qualifying characteristics, or if it was just sort of a volunteer group.
Lacy?
Yeah. Thanks for the question. The districts volunteered. They wanted to do this as part of their efforts to bring more students back into classrooms, and the Department of Health and Health Commons are here to support them in those efforts. And so, you know, if there are additional districts out there that need this assistance, we stand ready to support them as well.
I am very confident that if 100 school districts want to pursue this, that we'll find a way to help them. This is not a limitation, certainly not a financial limitation, because again, districts will be getting hundreds of millions of dollars in the upcoming days from both federal and state appropriations. So finances are not a problem. If this group of the Health Commons of assistance, I'm confident one way or another we'll be able to help districts that would like the assistance. I want to add something else too. It was suggested today another way we can help districts have more confidence to have a centralized additional data on our data dashboard showing infections as they happen in a school, to identify any infections that do happen in a school, to put that in a dashboard in the Department of Health. We are happy to do that. Moving in that direction, I believe. We have to check some federal law first, but we hope to provide that as well.
All right. Up next, we'll go to Essex Porter with Cairo. Go ahead, Essex.
Governor, when we heard from Republicans discussing their budget today, let me paraphrase what they were saying. Representative Stokesbury said that because education is a paramount duty of the state, that you as governor have the constitutional authority and the duty to order schools to reopen. Why not act more affirmatively under that authority instead of asking for volunteers?
Well, I believe that the good legislator is incorrect in his assessment, fundamentally. I know that's a rare event to say that, but it is the case. And I'm quite sure if you ask constitutional experts, they'll reach a different conclusion in our state. There are other states that have constitutions and laws that do allow, in some sense, governors to take that action. So fundamentally, that's the reason. Now, there are some things that appropriately, you know, we can try to incentivize folks to go back to in-school instruction. That's what we're doing today, talking about this issue, to provide incentives in this regard. And that is what we're doing.
All All right, we've got time for a couple more. Up next, we'll go to Jerry Cornfield at the Everett Herald. Go ahead, Jerry.
By the way, I really appreciate it when the Republic give me more authority than the state constitution allows. I find that an encouraging trend. I hope that it will continue.
All right, go ahead, Jerry.
Governor, I'd like to go back to your conversation about the transportation package. You laid out some of the elements. I guess I'm wondering first if are you and your team putting together a package to put up with the Senate and House that are out there, or are you working off of the two packages from the House and Senate transportation chairs to come to a agreement? I wonder if you could talk a little bit about the process and what amount of money do you think is sort of the round figure you think needs to be the target?
So I have taken a strategic role of helping these parties develop this package rather than directing a particular either number or project list. I have found that can be the most productive way to advance the ball here. So I'm talking to legislators to get them to work with each other to develop a project list and potential ways to finance them. And I just had a discussion with Jake Fye today, who's done a fantastic job. He's listened to, I don't know, 100 people on how to develop this package. He's not the only person who's working hard on this. Chair Hobbs has a package he's working on. So my role is to get these folks to work together, and I'm hopeful that that succeeds.
All right, up next, we'll go to Keith Eldridge. Go ahead, Keith.
Governor, you're moving ahead with education. How about phase 3? Have you decided when phase 3 is going to start and what it's going to look like?
We have not identified that. We just put the finishing touches on phase 2. So no, we have not identified our next steps. I think that we will be looking at the science in the next immediate future as it develops, both as to how prevalent the new variants are, how the current favorable conditions are continuing over the next several weeks, whether they continue to develop, and we've been very pleased with the declining numbers, as you know. We also want to see some science on the effectiveness of the vaccines against these new variants. That science is very rapidly developing. There's some good news and some troubling news on that front. And so we're going to need to look at some of those things to figure out the next stage of this. But again, I'm very pleased that we've been able to have more business activity. By the way, that's not the only solution. We want to provide and have, through the bill we just completed, to help these businesses financially while we continue to move to more normalized growth. So I don't have any news for you today.
All right, time for 2 more. Up next, we'll go to Mayor Kawash with KXLY. Go ahead, Mayor.
Hey, Governor, we were hearing today that communication between the local health districts and the State Department of Health hasn't changed much over the last few weeks, despite the state now getting a 3-week supply info ahead of time. Any idea when the local health districts might find out further out when they're getting doses?
Lacy, would you like to address that?
Yeah, thanks, Mayor. We are actually in conversations with local health about building for them a longer-term framework for allocation. So we want that strong prediction for our local partners in public health as well as the healthcare system so that they can plan better and we can get more people vaccinated and they can see and hold when they're going to have clinics farther out.
I just want to say that we want to do as well as we can on this, but we can only be as good as what the federal government tells us. So today we were just told there would be an expansion. That's really good news, but we don't know what the number, how that translates to our Washington number yet. And we have to get our orders in Thursday night. I think you can see the dilemma we face. So it's really great news that these things are changing for the good, but it creates a little bit of a difficulty for us giving more information to the local folks.
Yeah, and just to reiterate, right. We all want the same thing here for the people of Washington. We want a more seamless registration process for people to sign up. We want our providers to have longer term and more sustainable supply of vaccine, and we want that as well. And we're all working towards those shared goals so that we get more people vaccinated, more people protected, and emerge through the pandemic soon.
I think I might have forgotten to mention, too, that through all of this difficult thing that we've been working through, we are 12th in the nation in the delivery of these vaccines. So we appreciate everybody working hard on this.
All right, we've got time for one last question. We'll go to Robert Mittendorf with the Bellingham Herald. Go ahead, Robert.
Hi, thank you, Governor. I think everyone in Whatcom County is wondering why we got no vaccine this week.
Well, first off, anyway, let's address that.
Thanks. I will check Whatcom County's specific numbers. I do want to make sure people are aware that we did have this week a prioritization of second doses. And we prioritize those over first doses due to some challenges that our providers were having following expansion of vaccination in mid-January. So last week we had orders for more than 170,000 second doses of vaccine, which was essentially most of our supply of first and second doses. So a very limited supply of first doses that went out this week from the state. And a focus on second doses. I also want to make sure people understand that the federal pharmacy program, which the governor mentioned, was started this week, and so there are some first doses available through that.
I should note, too, that we try to keep things as geographically even as possible, and we look at that. We think we've been pretty successful, counties having realistic, fair allocations given their populations. So we are paying attention to that, and if anybody thinks it's seriously skewed, I know they're going to let Lacy know about that.
Any closing remarks?
No, again, this is a challenging time for us, as it has been for some time, but I really do believe this is a moment to look at what we are capable of doing in Washington State. And what we're capable of doing is opening our schools in a safe way by using the protocols that our brilliant educators have been able to develop. And I am encouraged that more and more communities and schools are using those tools to good effect, to tremendous benefit to our most precious assets, which are our children. That is just really heartening to me to see that progress we're making. I want to thank everyone who's been engaged in that effort. We're having significant improvement in our vaccine delivery system with all of the frustrations we have, and they are enormous. I know that Washingtonians, while they are searching for this vaccine, realize that the best solution to this is more vaccine, which is coming. And I appreciate that, and I'm very happy about that. I'm happy about the progress the legislature is making on multiple phases, not just helping businesses and workers as happened last week, but the things I talked about today, I think we have good chance of success. So this is a sunny day meteorologically, and it's a sunny day in Olympia as well. Thanks very much. Please be well.